A Tale of Two Hygienists presents this week's TIPisode, quick and easy tips to keep you up to date and presented by the experts in the profession. Now, get ready for your unofficial TIPisode.
Hello, my name is Stephanie Botts, and I am a clinical dental hygienist and ergonomics specialist offering ergonomic assessments and coaching to dental professionals. I'm really excited to be sharing some tips and tricks today to help you practice safer. My favorite people to talk to are dental workers and dental professionals, so I'm really excited to hopefully offer you some tips that will help you in practice. So I think a lot of us in dentistry understand how physically demanding, not to mention mentally and emotionally demanding, our job is, and that we are at higher risk than the general population for developing injury and possibly needing surgery or early retirement or disability later on in our careers. I think that it all starts in the operatory for the most part, as far as how we are practicing on a daily basis. It's all of those little things that we're doing every day in the op that really add up at the end of the week, month, or year, and so on. And so it's really important that we focus on those little things that we're doing every day. So I don't know if you know this, but a recent study put out by the American Dental Association stated that 84% of dentists report pain or discomfort while they're working, and 14% of those said that it affects their work. And then in another study, 96% of dental hygienists reported pain due to their clinical work behaviors. So these numbers are very high. To me, they're shocking, frankly. But I wonder, how is this pain, how is this issue affecting their daily life? And that's what I'm really big on, is quality of life. So obviously I want you to be healthy and happy and productive at work, but after work is what's really important to me. I want you to be able to enjoy your life and engage with your family and friends and not be in pain. So that's why I am so passionate on ergonomics, because we work so hard in dentistry and we deserve to have a nice, healthy, happy life. And so I'm trying to do my small part to help people with that. So over the next few months, I'm going to be offering a lot of ergonomic tips and techniques for you. But today I would like to start with something called microbreaks. I want to explain why those are important and how we can incorporate those into our day. What happens when we're practicing dentistry is we isometrically contract certain muscles. And when that happens, when the muscles aren't given a chance to break or given a rest, pressure builds up on the inside of that muscle and cuts off blood flow. So we all know that blood flow carries oxygen and nutrients and promotes healing, and it removes waste products, right? So if you have a muscle that's contracted for an extended period of time, that's under incredible strain, and it's not getting the nutrition that it needs from the blood, that's when we start experiencing things like pain and fatigue and eventual loss of motion. So it's really important to reintroduce blood flow to those muscles as often as possible, and that's when the micro breaks come in. So a micro break is a very small little 20 to 30 second stretch break that you take every 20 minutes. So you can set your instruments down, take a break, and stretch out your forearms or some muscles in your neck. Any muscle, it doesn't really make a difference. What the goal is to give yourself a chance to rest and reintroduce blood flow to those muscles. Okay, so the blood starts rushing into those muscles that were previously contracted, and it starts to promote healing. So I recommend taking these every 20 minutes. And so for a hygienist in a procedure, if you're doing a regular recare appointment, you could probably just take one. If you're doing SRP or a longer appointment, you might take a couple micro breaks. But this has been shown to reduce pain and fatigue by dental professionals. So now I'd like to just go over a few different stretches that you can do. And I'm going to describe these as best I can on audio. But if you follow me on Instagram, I'm at steph.posturepros. I have videos for these stretches as well if you need further instruction. The first one I want to go over is a chairside trapezius stretch. So our upper traps are the most overworked muscle in dentistry, okay? And so it's really important to stretch those out. If we start to have dysfunction in our trapezius muscle, it has all sorts of fallout for our neck and our back, and we could develop injuries from that. So I recommend doing this stretch several times a day. But what you do is you could be just sitting on your stool. You don't even have to get up out of your stool. You're going to take one hand, let's say it's your right hand, and point it down towards the floor. You want some tension in that arm. And then you take your opposite hand, your left hand, and grab the right side of your head and pull it away from that arm that's stretching down towards the floor. And you should feel a nice stretch along the side of your neck and down into your shoulder. But the key is to hold that tension in the arm that's pointing down towards the floor, and then holding this stretch for at least 20 seconds. And you can take some deep breaths while you're taking the stretch as well, incorporate some breath work, and that will help oxygen get into that muscle even more. So you're going to do one side, and then you do the other side for 20 seconds. That's a great stretch to do. Another one is a forearm stretch. So because of what we do, especially as hygienists with our repetitive motions with scaling, we build up a lot of pressure and tension in our carpal tunnel in our wrists and also in the muscles of our forearm. So I recommend doing this forearm stretch if you have issues with your wrists or your arms or like tennis elbow, something like that. But then also if you've been doing an SRP and you've been hand scaling for a long time, when we're gripping our instrument so tightly, which most of us do while we're scaling, that builds up a lot of pressure. So for the forearm stretch, we're going to do a couple different ones that you stretch the top of the forearm and then the inside of the forearm. So to stretch the top, which is stretching out the flexors, you're going to punch your arm out in front of you, making a fist, and then you're simply just going to rotate that fist down towards the floor. So my forearms are really tight, and that's all I need to do. But if you want a deeper stretch, you can grab your fist with your other hand and then just pull that wrist down towards the floor. And again, you're holding that for 20 seconds. And then to do the extensors on the inside of the forearm, you just flip your hand over, almost like you're asking for money, and then you rotate your palm down towards the floor, and you should feel a nice stretch on the inside of your forearm there. And then again, if you want a deeper stretch, you can just grab your palm with your other hand and pull that hand down towards the floor. And again, hold these stretches for 20 seconds. Another stretch you can do is a piriformis stretch. So this is on my Instagram as well, but you'll just be sitting on your stool and then you'll take one leg and cross it over your other leg, almost like you're trying to sit Indian style on your stool. And then you just lean forward. And you should feel a nice stretch there in your glute, in your piriformis. That's a muscle that gets real tight when we're sitting so much. So that's a good stretch to do, especially if you've been sitting for an extended amount of time. So you'll lean forward, hold that for 20 seconds, take some nice deep breaths, and then do that on the other side. And like I said, all of these stretches are available on my Instagram. So I'm at steph.posturepros. I also have a website, posturepros.net, that you can visit for more tips and tricks, some blog posts, and then also information on the coaching services I provide. So I'm really looking forward to the next few months where I can offer you some quick ergonomic advice to hopefully help you practice healthier and happier. Thank you.
We hope you enjoyed this week's TIPisode. Be sure to reach out to our guest experts and let them know how helpful their tips were. Follow A Tale of Two Hygienists on Facebook, Instagram, and head over to ataleoftwohygienist.com and subscribe to our newsletter. You can also email us at ataleoftwohygienist@gmail.com and keep listening for more awesome content from your unofficial dental hygiene podcast.